maybe not necessarily 5 years ago, but probably if you go farther back, most of these oropharynx and head and neck cancers were smoking related. And the patient's outcomes were a lot poorer. They didn't do as well. They had more toxicity with treatment, and they had more local failures and regional failures, and the disease recurrence. And I think now we're really starting to see younger patients, relatively healthy, with HPV-associated malignancies that do well. And so it's really important, I think, in the future to make sure that we're not increasing toxicity, right? So you have patients that are living a lot longer with no evidence of disease. You want to make sure their quality of life is still really high. And we did actually assess our toxicity in our study, and we looked at what we considered meaningful toxicity, or grade 3 or higher toxicity, which is based on the CTCAE version 4, which is a validated grading scheme for toxicity. And what we found was, and we did that as late toxicity at 3 months. Initially, it was 9% of our patients. However, if at the time of their last follow-up, only 2% of the patients actually had persistent late toxicity, meaning that we were very proactive with how we were managing patients that had G-tubes or a feeding tube in place, of making sure they're meeting with speech and swallow, making sure they're meeting with the nutritionist, making sure that we're controlling their pain so they're still able to, swallow during treatment, maintaining the swallowing function and using those muscles. And so I think there's a lot that can go into really helping decrease the toxicity for our patients. I think that's kind of where the future is going. There's a lot of national studies going on, or one major national study currently on de-intensification of treatment. And so I think that kind of goes in that whole theme of these HPV-associated cancers. Patients do well. And so it's really important that we're not compromising outcomes, but also improving their quality of life and decreasing their late toxicity.